Hi, this is Chukudum from the Cell Farms. This is in a series of videos to help educate ourselves in the issue of broiler production. Today we're going to be talking about coccidiosis. We're going to be dealing especially with coccidiosis, what coccidiosis is, the treatment, prevention, and vaccination for coccidiosis. Coccidiosis is an acute disease. It's a protozoan disease. It's basically a parasite that lives in the intestines of your birds. And basically what it does is essentially suck nutrients and blood in the system of your birds, preventing your birds from having an optimum performance. Now this disease is caused by the Emeria species, and there are 7 species, but only 5 of them are common. Of these 5, Emeria tenella is the most fervent and common. The pathogen that causes coccidiosis is coccidia. Birds are infected when they ingest coccidia from wet litter. So it then keeps multiplying until they become too much and they attack the internal walls, resulting in the bleeding, which is the blood you see in the poo of your birds. Now, there are 2 conditions that help coccidia. One is wet litter or bedding material. The second is overcrowding. So you have to make sure the density of the beds, the number of beds you have in a room, is not too much. What are the symptoms of coccidiosis? The first symptom of coccidiosis is that your birds will lose appetite. There will be a tendency they will not be eating as much as they were eating before. So you will have reduced feed intake. The second is emaciation. You find that your birds are not meeting your weight goals. Strike that. Let me start from the beginning. Symptoms of coccidiosis. The first is loss of appetite. Your birds will not be eating as much as they used to. So if you are measuring the quantity of feed their birds were eating, you find that they were not eating as much. The second is emaciation. The birds will not meet the weight objectives. So if you measure your birds every week, you find, and there's supposed to be a range that your birds are supposed to be in based on their age. So if you have first week, there's a range they're supposed to be in, second week, third week, and so on and so forth. So if you weigh your birds and find out that your birds are not in the weight range they're supposed to be in based on their age, there's a very good sign that coccidiosis may be the cause of that. The other sign you may notice is foamy yellow poo. This would be a sign that you may have the beginning stages of coccidiosis. And of course, the last stage of coccidiosis is when you see blood in their poo. At that point, you know you're going to start having mortalities in a couple of days, if not immediately. Now, at this point, I'd like to say that you have to be careful with coccidiosis. I want to tell you that if you have birds in deep litter, you have to assume you have coccidiosis. The only issue is whether it's severe and how it will affect your birds. So, because you're not seeing red poo or you're not seeing blood in their poo does not mean that they don't have coccidiosis. But the worst part about coccidiosis is that your birds may have coccidiosis and you not see any symptoms. So that's why it's dangerous, unlike other diseases that once your birds contract them, you see symptoms. So it's very important to assume that on a practical level, you have coccidiosis. Now, how do you prevent coccidiosis? As part of your preparation for your birds to arrive, and you're cleaning and disinfecting your pen, I'll suggest strongly that you paint the floor and the first 2 feet of your walls with cement and paint. And we're having a video coming up soon demonstrating how you do that. And that's one of the reasons why I ask you to subscribe, so that as soon as these videos come in, you'll be the first to know. The second is you have to maintain great litter management. For the first 30 days, you freshen up the litter in the pen by adding new shavings, and after 30 days, you start to change your litter frequently. You notice after 30 days, almost every 3 days or 4 days, you have to change your litter. The other thing, like I said before, is you have to give your beds good space. You have to, don't overcrowd them. Overcrowding is counterproductive to the well-being of your beds. And now, one of the things you have to do in terms of daily routine in the management of your beds is to check their poo every morning. So when you wake up, one of the first things you do is to check and see the color and texture of the poo coming out from your beds. And you have to weigh your beds weekly. So as I said earlier, there's a range your beds are supposed to be in every week. So you have to weigh them every week, every 7 days, to just make sure that everything's going well. If you do not vaccinate your beds against coccidiosis, you must give periodic preventive dose of organic or synthetic anti-coccidiosis medication. So if you're doing organic medication, that's a treatment you use to prevent coccidiosis. If you're not doing organic and you're doing synthetic production, there's also drugs you can use. One of the best things you can do is to vaccinate against coccidiosis. And I will do a little bit of explanation at the end as to how you do that. Now, coccidiosis vaccination using Cocciplat vaccine, as I said earlier in another video. One of the vaccines you can use for coccidiosis is Cocciplat. That's the one I use, and I found it very, very effective. And what you do for 1,000 birds is you get 1,000 doses of Cocciplat. You get a dye that comes with it, and then you get 250 ml of vaccination, or what they call injection water. And you remove their feed for about 2 hours. And then you mix the 1,000 dose vaccine with dye and 250 ml of injection water into 5 kg of feed. And you mix the feed until it turns into the color of the dye. So essentially, just get a 5 kg of feed. These 3 items, you mix them and you massage them into the feed until the entire feed is showing the color of the dye. Then you know it's okay. You use 50 trays. You get 50 trays and you put 100 grams of feed in each of the trays. The reason for that is you want to make sure all the birds are feeding at the same time. So 50 trays, which is 1 tray for every 20 birds, will be enough to do the job. And you give to your birds, and when you give them this feed, you don't let them eat anything else until they've completely finished everything on the trays. Then you can give them additional feed. As I said before, one of the ways to treat coccidiosis is, one, if your birds ever come down coccidiosis, you have to change your litter. And once you change your litter, now, assuming you didn't do vaccination, you have a couple of drugs you can use. They're classified under sulfur drugs and anti-coccidia drugs. There's so many of them in the market. Your vet doctors or your vet shops would give you a number of options you can use. For those of you doing organic production, you can use some herbs and spices for treatment and prevention of coccidiosis. The best you can use is bitter leaf. Bitter leaves, even if I give vaccination against coccidiosis, I still like to use, because it's not just for prevention of coccidiosis, it's also an antibiotics. It's also very good for the gut health of your birds. Most of you know that almost every illness of your birds starts from the gut. So having a healthy gut is essential. And it's also a growth promoter. The other medicine you can use, or the other vegetable you can use, is scent leaf, which is another one you can use either in place of bitter leaf or in addition to bitter leaf. You can also use neem leaf, which is dogoyaro. You can use garlic. You can also use pawpaw leaves. But I think out of all of these, bitter leaf is the cheapest and still remains the best. If you have gained from this video, don't be selfish. Subscribe and share so that other farmers may get the same information. Thank you.